For more than 30 years, McLaren Port Huron's Women's Wellness Place has been the leader in breast care services for our region. We've recently expanded these services, and to learn more, I'm speaking with one of our experienced breast surgeons, Dr. Kimberley Clark-Paul. Dr. Clark-Paul, thank you so much for coming to speak with us today.
Thank you.
Yeah. So tell us more about these services that are available in Women's Wellness Place.
Well, the very nice part of it is that my area of expertise is cancer surgery, specifically breast surgery, and I'm now able to provide that service right in the Women's Wellness Place, where we have our radiologist, and so we can have coordinated care where we can review the films right when the patient is there. So it makes it a really nice option for the patient. Not only do they have the clinical piece with the surgeon, but we can also look at the films or the ultrasound, or if we need additional studies, we can sometimes get those additional studies at that appointment. Not always, but sometimes.
That sounds like a great option.
It is.
So you talked about your coordinating with the radiologist, but there are other specialty physicians that help care for our patients.
Well, absolutely. So if a patient is actually diagnosed with a breast cancer, what happens is it's a multi-coordinated team that we need to have available for the best patient care. Specifically, physician-wise, just physician-wise, we need the pathologist, and we'd like to review those pathology slides. We have the radiologist, obviously, who many times the cancer is diagnosed radiographically. We have medical oncology, who is very integral in the treatment, radiation oncology, and the surgeon. So those are just some of the physician specialties that we have all available, very closely coordinated at the Women's Wellness Place. Now, in addition to that, we have multiple other services. We have a nurse navigator who is wonderful in helping our patients go through the system. We have social workers. We have a breast cancer support group. So we have all of these different things that are available to the patient.
Right, that's great. And a lot of that care is kind of coordinated through our cancer committee as well.
Correct.
Yeah, that's great. So it sounds like this breast care program is more than just the surgery too. What other types of breast issues are you treating here?
The breast cancer service also, I want to just say the other piece that I like is that it also focuses not just on the patient, but on the family and on the needs of the family while the patient's going through this very difficult time. So other things that any breast issue, we are happy to treat, to diagnose, and to treat. So it might be an infection, it might be after a patient has had a baby, maybe they're having some problems with pain at the time when they're trying to breastfeed. It might be breast pain, it might be breast lumps or nodules that are not cancer. We see a lot of that. It might be in a man who has enlargement of the male breast called gynecomastia. So any breast issues, we're there to take care of.
That sounds great. So it sounds like the journey is unique for every patient. So what are some of the other services or treatments, like the spectrum of care that's available?
Well, that's what we were talking about. So we have a nurse navigator, because each patient is an individual, and each patient family has an individual journey that they go through. And so our nurse navigator helps bring in, maybe they need help with some of their financial things, and they can help them navigate that road. Or maybe they need help with getting to their appointments. They even help with transportation at times. So it's a global approach to the patient and all of the patient needs.
Now, I also understand that there is a breast cancer tumor board. Can you explain what that is about?
Yeah, absolutely. So every patient that gets diagnosed through the Women's Wellness Place with a breast cancer has their case presented at a breast cancer tumor board, which is fantastic, because at that board we have medical oncology, radiation oncology, surgery, we have the pathologist and the radiologist present, and their unique case is presented with the unique pathology, the unique stage of the disease, what the woman's history is, what the best treatment according to national guidelines are for that patient. So that patient can be very comfortable that they are getting the highest standard of care possible, even in the United States, right here at Port Huron McLaren.
That's great.
Yeah.
Sounds like everybody's kind of working together really to address anything from treatment.
Absolutely, it's a great team.
Yeah, treatment on. Okay, that sounds like great information. We do need to take a break, so we will continue this discussion about our breast care services when we return.
Hello, I'm Jennifer Montgomery, President and CEO at McLaren Port Huron, and I'm excited to invite you to come visit our brand new patient tower. Construction is complete and we are open to have you come visit us. We will be open for business on October 15th, but prior to that, please come see us on September 29th between 10 and 2 p.m. We have a variety of activities planned for you and your family, and there will be complimentary refreshments available. We will have valet parking out front and shuttle service available from nearby parking lots. I hope you and your family are able to join us for the celebration and grand opening of our new patient tower.